everybody, Joe Joseph here for thedailysheeple.com, and this is your news shot. So, Daily Wire has a piece going, this is going on over in England, UK, and we should really be paying attention to this because with Obamacare now on the chopping block, this could be a very real possibility here in the United States. Donald Trump has come out in the past in favor of a single-payer system. Over in the UK, the National Health Service has a single-payer system. And now over there, they say health rationing is starting to happen. Obese and smokers are now banned from routine surgery. It says, for those who extol the virtues of socialized medicine and protest that it could never, never, ever lead to rationing. Here's a wake-up call from the UK. Health experts in the UK are warning that obese people and smokers will be routinely refused operations across all of the UK in the very near future. The latest case in this comes from North Yorkshire, where patients having a body mass index of 30 or higher, and if you're a smoker, you'll be refused routine surgery for over a year for non-life-threatening conditions. Listen to this. This is right off of the website for Vale of York Clinical Commissioning Group. It says the local systems are under severe pressure. Hospitals are being warned they will not be paid for surgery if they carry out operations on obese patients who are not exempt from this policy. This work will help to ensure that we get the very best value for the National Health Service and not exceed our resources or risk the ability of the NHS being there when people really need it. So apparently, if you're obese or you're a smoker, you're not of value and you're wasting precious resources on somebody. Interestingly enough, how many people out there, just by virtue of bad genes, perhaps, you don't have the money to go to the doctor to figure out what the problem might be, if it's like an over or underactive thyroid, any host of different ailments can cause obesity. I mean, it's not just like everybody's like, nom, 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 sugar, sugar, sugar. That's not exactly how it always works. There are people with legitimate problems that might require legitimate surgery. And how could you go and hold people back from getting these necessary operations and procedures just because they may be obese? Now, smoking, that's a little bit different. We make the choice there. Sometimes, if you're obese, it's actually not a choice. Could be because, there's a whole host of reasons. But for smoking, okay, I get it. However, to keep people from having any sort of procedure, say like knee replacement or something like that, because I smoke, are you kidding me? Look, if you pay taxes and you pay into the system, you should be entitled to those services. It doesn't matter what you do. This is what the government, your non-representing representatives over in the UK, this is what they've decided on. They decided to embark upon this single-payer route, knowing full well what kind of costs are involved in implementing a single-payer system. Over here in the United States, we can look and say, okay, well, we want to institute a single-payer system here. Currently, there is legislation introduced in Congress called the Medicare for All Act, that would basically do just that. The problem is how much it costs. It is extremely expensive to not just provide the services, but also it's the bureaucracy, it's the administration of it all that's really where it becomes like a huge money sucker. Now, I am not a proponent of single-payer health, but I will say that to me, if I had to choose between single-payer health and what we have now, I'd almost say I'd rather go with single-payer health, only because what we have now is absolutely crappy. I know that my insurance leaves much to be desired, and I've seen it just erode over time. Each year costs are more, benefits are less. Whereas, back in the 90s, it was a lot different. 90s, early 2000s, healthcare wasn't all that expensive. Things were covered. Co-pays were easy. There was no, you have this out-of-pocket cost that you have to hit first. before we'll even cover anything. And then when we do, it's only 80%. This kind of stuff. There's all these different rules when it comes to healthcare now, where it would be a lot easier if it was just single payer. I'm sick, go to the doctor, everybody's covered, yada, yada, yada. The other mistake that's commonly there is it's a right. Let me say this. When healthcare becomes a right via a constitution or otherwise, you instantly cause the quality of care to decrease. Because now you have to spread out resources to a very large section of the population versus those just paying into it. And that in and of itself has a lot of consequences, because look at what we have now in America. We have 94 million Americans that have dropped out of the workforce for whatever given reason. 94 million Americans have dropped out of the workforce. So if they can't work, they're not paying taxes. They're not paying taxes. They're not paying into the system. However, the system still has to cover them. It stretches resources even further, and it erodes quality of care. Whereas if, you were able to just say, go into a doctor, pay cash for those services, let's not even worry about insurance unless we get into catastrophic care. It's kind of like if you go to the car, buy a car, you don't have insurance that covers the oil change. You don't have insurance that covers the brakes if they fail. You have insurance for catastrophic things like car accidents, liability coverage in case you cause any damage to somebody else, that kind of thing. That's where insurance really has value. But this over time, these HMOs and everything that was, again, a part of Richard Nixon, probably the worst president ever in the history of the United States, goes and implements this whole HMO scheme. It was totally a money sucker, and a huge cash cow for the insurance industry. It was a softball throw to them, and boy, did they hit it out of the park. Well, now that we recognize this, it's time to probably enact some real reform, do away with health insurance on the level of routine care, and totally just keep it catastrophic. If you got to go to the primary care physician, hey, it's $50. Boom, done, out the door. $50. You got to go pay for a prescription. You bring these costs down to something more manageable, and that's where you can institute cost controls. I'm not for federalization or government regulation of anything, but I'll tell you this. If you let these corporations go unchecked, they do some pretty god-awful stuff. And to me, when you price life-saving medicines or medicines that can improve the quality of life of people, and you price it out of range of people, that is criminal, especially when you can do this and still make a handsome profit without having to, price it so far out of range. I mean, you're talking about profit margins in the thousands of percents, if not more, and this is the problem, the inherent problem with our health system. So take a good look at what's going on over in the UK, because with single payer health, this is what's going to happen. Resources get stretched too thin, not enough people paying into it. Now we have to start cutting. And when they start cutting, it's only a matter of time. Oh, you're 64 years old. You're too old to get that triple bypass procedure. Not because you're not physically capable of getting it, but because you're too old. They see that there's not enough value. You've done your time. You've paid into it. But you know what? You're 64. You're not going to be working much longer. You're not going to pay into it anymore. Just send you off to pasture. Here's your Agenda 21 depopulation. Just another cog in that Agenda 21 depopulation scheme. Because now you'll have a death panel that decides whether or not you're eligible for services. And it's just criminal. I'm Joe Joseph. This was thedailysheeple.com's News Shot. Feel free to comment below and visit our website at thedailysheeple.com. Have a great day.